Yeah, so unfortunately, I'm going to need to differ with my respected co-panelists. I don't believe that Africa has done a great job. And I think, if anything, we haven't learned from the experience of the swine flu pandemic in 2009. South Africa is not an outlier. What makes it an outlier is that it's got much more robust surveillance systems than anywhere else on the African continent, unfortunately. And when you look at South Africa as a country, we constitute less than 5% of the African population, yet we contribute to 45% of all of the deaths that's been recorded on the African population, on the African continent. And even that 93,000 of recorded deaths that's been identified in South Africa is only 1/3 of the COVID attributable deaths that's occurred in South Africa. So the mortality rate from COVID-19 using excess mortality estimates in South Africa is at about 480 per 100,000, which is more than twice the mortality rate in the United Kingdom. Unfortunately, other African countries haven't been able to have real vital registration data in place to actually estimate this excess mortality during the course of the pandemic. And those numbers will only become available to us probably in about 2 years from now. So I think it's a highly optimistic view that Africa has performed extremely well. Unfortunately, I think the impact that COVID-19 has had on the continent is yet to be realized.